Is everybody there? No.
We're here.
Oh, okay. Mike, can I get to YouTube, do you think?
Oh yeah, of
Oh.
course. Yeah. In fact, let's see. Trying to tell you how to go to it.
Well, I don't want to hold. I can fool around. That's
Yeah, if you just go to YouTube, I think it's No Stow Selectman. If you search for that, that's the page. And
okay.
It'll be shared on
Okay.
the Facebook. I know you're not on social media, but it'll be shared on the social media pages and stuff. So
Yeah, I like the YouTube better. Thank you.
yep.
Okay. All right. I think we're just waiting for Senator Summers, and the live YouTube has started and it has been shared on the North Stonington First Selectman page, as well as the Town of North Stonington pages. So feel free to share on any pages for any of your constituents that you'd like to participate with us. And just give Senator Summers just another minute, and she could always pop in afterwards, but before we get started, we'll give her another minute or so to hop on. Why don't we get started? Appreciate everybody who's taken the time to join us tonight for our virtual discussion. I'll just mention a couple of things. So first of all, my name is Mike Urgo. I'm the first selectman of North Stonington. Going to help to try to facilitate this discussion with some local leaders and our Director of Health, Steve Mansfield for Ledgely Health District. What I'll try to do here is keep an eye on the Town of North Stonington Facebook page to see if any comments come in that are written. We'll try to, we will have plenty of time for questions and answers at the end of a short discussion from each of the people that are guests on the call. So if you have a comment, you can type it in there. If you're calling in, you'll have the opportunity to unmute yourself on the call after we're done with the short presentations from each of the guests on here. And I do see, I think Senator Summers is hopping on, which is perfect timing. So, so again, if you're going to have any comments or questions after we go through, so the lineup will be, we'll start with Director of Health, Steve Mansfield with an update. We'll go to Senator Heather Summers for a state update, and Representative Kate Rotella will give us an update, followed by First Selectwoman Danielle Cheeseborough, and then myself, and then we will open it up for comments and questions from those who are joining us, be it on the phone or by typing in a comment on the Town of North Stonington's Facebook page. And if it's possible to type in on YouTube, we'll also check that out as well. So without further ado, I do see Senator Summers' audio is still connected. Oh, there she is. Wonderful. Hello, Senator Summers. Welcome.
Hi, how are you?
Good to see you. We're just getting things kicked off, and I was just going to, I just was given the ground rules for everyone, and we're going to start with a great update from someone who's been very, very busy over the last few weeks, and that's Director of Health for Ledgely Health District, Steve Mansfield. Steve, welcome, and the floor is yours.
Thanks, Mike. Hi, everyone. How are you? I'm going to start by going over a little bit of the data, and I want to preface that by saying the data changes so quickly, it's difficult to stay on top of it. As you're probably aware, every Friday afternoon, Ledgely Health District puts out a comprehensive spreadsheet that details all of the cases district-wide, as well as the deaths and age ranges that are associated with all of those cases and the towns where those folks are from. So people in our communities can have a general idea of what the case burden looks like. So as of today, and as I said, these changed pretty dramatically, the numbers today are much different than they were on Friday afternoon when we released that data. So as of right now, we have 367 cases district-wide and 29 deaths. When I mention the deaths, I think it's really important to note, and the cases as well, if you just look at the raw numbers, it's easy to, I think, misconstrue what the true disease burden is in our community. For example, Waterford currently has 82 cases, and you would think there's a lot of COVID-19 out there, but really the majority of those cases, 73 of those 82, are in long-term care facilities. And that holds true, not proportionally, but it does hold true for deaths as well. We have 29 deaths district-wide, and 21 of those 29 took place in long-term care facilities. So unfortunately, long-term care facilities in any institutional setting, they're ripe for any type of respiratory illness to be passed from person to person. And also, unfortunately, the people in those long-term care facilities are generally more susceptible to the serious complications that go along with COVID-19. So when you look at the raw numbers, keep in mind there are a lot of things that contribute to what those numbers say. Another one is how rural a community is. North Stonington, I think, has been blessed with a very low caseload, and that has a lot to do with not only the number of people, but how spread out everyone is. And that holds true pretty much across the country and across the state, where you have a lot of people concentrated in a specific area. The rates of transmission and the actual raw numbers of cases are that much greater. So I'm happy to answer any questions now or at the end regarding our data. I will note that we get a lot of comments from the public about, why do we only present the bad data, if you will, not the good data, the number of cases, for instance, that have recovered. And the answer is pretty simple. COVID-19, like a lot of other diseases is what's known as a reportable disease. It's in the Connecticut general statutes that when a case of COVID-19 is diagnosed, it has to be reported to me at the local level, the director of health, and also to the state health department. So we get those numbers and we're able to compile them, analyze them, and so forth. We don't get the data at the local level regarding the number of people who have recovered after having COVID-19. The hospitals do have those numbers, and they're transmitted to the Department of Public Health. So they do have more detailed information about that, but I thought it was probably important to note that. One of the things that's keeping our district and a lot of health districts across the state really busy is contact tracing. And you've probably heard about contact tracing in the news lately. It's one of a number of things that has to happen before we can reopen the state per the governor's plan. Contact tracing and an increase in testing. Those are a couple of the things that local health department has a role in. So what is contact tracing? It's a pretty simple concept. If we get notified of a positive COVID-19 case, then we have a team of 17 Medical Reserve Corps volunteers, MRC, and about a half dozen staff members who are trained to contact that individual and ask a series of very detailed questions about basically where they've been and who they've seen and who they have come in contact with. Then we reach out to those individuals and make recommendations for isolation or quarantine to get more information about possible transmission. So the goal of contact tracing is to identify not only the sick people, but the people who may have come in contact with that sick person, so we can institute measures that will keep them from infecting other people and break that chain of infection. So it's, as you can imagine, if we have 367 cases, we do contact tracing for every one of those, except for those that are in long-term care facilities. That's the responsibility of the State Department of Public Health, or those that we have missing information. It's not that common, but there are quite a few disease reports that come across our desk that are just not complete. There isn't contact information, or the person is moved, or just erroneous information. So we sometimes reach a dead end, but we do make an attempt to contact 100% of those people who live outside of long-term care facilities. So Ledgelight's been doing that since day one, and we have a tried and true method of doing it. It works really well, and we think we've been successful in a lot of cases of breaking that cycle of infection. The Connecticut Department of Public Health announced just last week that they're putting together a state contact tracing team. It's going to be web-based, and apparently there are roughly 500 people who they've identified to be contact tracers in our communities. So it's a little concerning at the local level that we have a system that works really well, and then this new system is going to be put in place. But we were happy to find out that all of the data and the policies and procedures we've put in place should mesh seamlessly with this new state system. And it's a welcome system for us because it has, it's much more robust than what we do. There are parts of the system built in to the system, texting, email capability. It will automate a lot of the things that we're currently doing, not face-to-face. We do everything virtually, but it will make things easier for us. So we're looking forward to that. We actually have offered to the Department of Public Health to be a beta tester for that. They plan on rolling it out formally within the next 2 weeks or so. So we're hopeful that that will provide us enough information to really make a significant dent in the morbidity and mortality associated with COVID-19 in our communities. A note on the data I mentioned before, reportable diseases. You know, we get the reports, DPH gets the reports. The reporting and the reports that go along with COVID-19 has generated a really daunting amount of data. DPH has processed more than 70,000 lab reports over the past 6 weeks, and that number exceeds what they typically do in an entire year for all of the communicable diseases that they process. So it really has put a significant strain on the system. And as you probably noted, up until very recently, the numbers that Ledgelight Health District was reporting were much higher than what DPH was reporting. Their system just simply couldn't keep up with the number of cases and keeping all that data accurate. And we were just ahead of the game. We had the resources at the local level to put out more timely and more accurate data. But DPH has put in place a lot of, or made a lot of changes to their system, and now those numbers are much closer. But we still like to track our own data at the local level, so all of our municipalities have a really good idea of what exactly is happening. The last thing I want to touch on is PPE distribution, personal protective equipment. So Ledge Light Health District, since the very beginning, has been providing limited amounts of PPE to the people in our communities who need it most. Generally, those people who are forced, for lack of a better term, to come in close contact with people, surgeons and so forth. If they don't have that N95 protection, they're putting themselves and their patients at a much greater risk. Recently, we partnered with DEMIS, Department of Emergency Management and Homeland Security, to set up what's known as a pod, a point of distribution up at the Mohegan Sun. So essentially what happens is PPE from various sources, the strategic national stockpile, some state, some federal assets come to this facility, and then they're divided up and given to various entities for distribution. So local health departments are responsible for providing PPE to primary care providers, hospices, home health agencies, and a few others. Nursing homes, long-term care facilities get their shipments directly. They actually send people right up to this point of distribution. It's gone very well. Unfortunately, as has been the case since the beginning of the pandemic, the amount of PPE that's out there doesn't equal the need. There are still facilities that are using surgical masks, which is appropriate based on the CDC recommendations. But in a perfect world, we would be able to provide N95 masks to anyone who needs them. And that's simply not the case yet. The supply chain, I think, is becoming more robust, and there's more stuff out there for distribution. But it's one of the roles that we have it's difficult to do. We have to prioritize who gets this PPE. And that can be a pretty tough decision. And not everyone wants to hear that someone else is more important or their job is riskier than someone else. We want to provide the PPP as quickly and efficiently as we can, but also distribute it in a fair way. So far, everyone has been very, very understanding, but it's a lot of staff time getting the PPE, repackaging and distributing it to all of those people in our community. It takes about one full-time equivalent to do that work. But so far, so good. And Mike Caplet from DEMIS Region 4 has been great to work with, and the cooperation is really important, I think, across the board. So I think those are the primary updates that I have. I'm sure there are other things on people's mind. They may want to ask questions, and I'm happy to try to answer those when we get there.
Thank you, Steve. So with that, we're going to give our 5-minute updates from each of us, and we'll start with very honored and happy to be joined by both of our state representatives, Kate Rattel and Senator Summers, who can start us off with an update. Senator Summers.
Okay, well, first of all, thank you, Steve, for that really thorough update. And thank you for all the work that you guys have been doing. It's amazing how well organized and professional our health district is. So that idea that somebody had with Harry Watson years and years ago, well done. And thank you for all you're doing. I have an update being on the Public Health Emergency Committee and our daily calls for DPH, just to talk about a few different things, perhaps. I wanted to let everybody know, I'm not sure if anybody is watching this, but Hartford Healthcare is going to be holding a mobile testing clinic at 100 Perkins Farm Road, hopefully beginning next week. They're just waiting for DPH approval. So they will be able to do some drive-by testing as long as you have a referral from your clinician that you are somebody who needs to get the testing. They're hoping that this will open up another 2,500 tests in our area. They've picked 3 locations and Mystic is one of them. So that's good news. We'll keep you posted on when they get the approval from DPH. And their hours will be 8 a.m. to 4 p.m. as soon as they get up and running. As far as to just kind of speak a little bit more about our long-term care and our skilled nursing facilities, I've been spending most of my time there, and that is where we're seeing a significant magnitude of the COVID patients. And I know there has been a lot of I'll say input from the community. I'm sure that Representative Rotella has been getting the same emails as I have, requesting that loved ones get to have access to those who are in long-term care and the skilled nursing facility, because the isolation is difficult. Many of the patients that have contracted the disease are Alzheimer's patients. The consistency of seeing the same person or the loved one is very important, and it's very, very difficult to be able to have that contact. That being said, it is imperative from a public health standpoint that we keep the rest of the residents and the staff in those facilities safe. And the way that we do that is to not allow contact, which is heartbreaking, but we're hoping if we can do this, it will just be for a period of time. So many of the skilled nursing facilities that I have visited to deliver masks or equipment are being very, very creative on how to maintain contact with those who are loved ones inside, whether it be chalk writings, parades, telephones, conversations through the window. It's really brought to light for me and for others this population that sometimes people forget about. And I want to do a huge shout out to those working in the long-term care facilities, because they're doing God's work right now. They are working tremendous hours under tremendous pressure. And I think that we are trying to do everything we can in the state of Connecticut to make sure that they are compensated and they have the equipment that we need. That being said, we had a meeting on how we protect those working in these facilities and living in these facilities going forward. As far as Eastern Connecticut, we have done a great job in social distancing, and we need to keep it up. Just because, as Mr. Mansfield has said, you don't see these large numbers of people that have been ultimately succumb to this virus here in Eastern Connecticut does not mean that it's not here. I can tell you that the hospital is busier now than it was 2 weeks ago with patients that are coming in with being COVID positive. So we might be seeing it at a slower rate, but we're starting to see more of it, perhaps as testing has become more readily available. There's a few things that have come up today, and I'm trying to go through this quickly. On campsites, campsites will be opening shortly. That's something that many of our rural towns are concerned about, because how are they going to handle people coming in who are from other states? And the governor has looked at an executive order that would allow anybody who owns a RV or a campsite to come to Connecticut and stay there with a recommendation to quarantine. So some of my smaller towns are very concerned about that, how they're going to implement that if they don't have enforcement possibilities, etc. So that's something that's coming down. Also today we had a meeting on, excuse me, summer camps. Many of our constituents are concerned about the summer. What are they going to do with their children if they go back to school? If they go back to work, if summer camps are going to be open or not be open. And that's something that we're working on with the Office of Early Childhood. We are meeting with the governor's office later this week, hoping to have some recommendations and guidance. But right now, excuse me, I have something caught my throat. The recommendation has to be 10 children or less, which really can impact some of our summer camps. And if you're going to have more than 30 students or children in a summer camp, even if it's a day camp, you're going to have to get special approval from the Office of Early Childhood Education. So we're working through that, again, trying to provide an ability for kids to go to camp or have camp in a safe environment and keeping their instructors safe. But our camps need to decide and have people sign up right now. It's another revenue stream for them. You know, we have the Denison Pequot Nature Center, we have nests, we have the aquarium camp. There's so many camps around here that is concerning. So we're hoping to have some information on that maybe later this week. And speaking with that, I just wanted to make an announcement that if you are a person who is considered a frontline worker and you are having difficulty finding daycare because many of the daycares have closed, or we've lost 3 more today that have shut down permanently, you can call 211, and there's a special program through the CARES Act that will hook you up with a qualified daycare provider, and it would also give you a $200 credit towards your childcare if you're a frontline worker. We're trying to do everything that we can to make sure that people that are caring for those who are sick, etc., have access to childcare, and we understand it's becoming increasingly more difficult. One more thing I will say, and I'm happy to take questions after, is I was asked by the Commissioner of Early Childhood and Children's to please announce that if you are someone at home who has a child who you're concerned about, you can call 211. And if they're an infant, there are still resources available. Births to 3 can do assessments through telehealth. And if you are someone who is not currently seeing a pediatrician, if you call 211, they can hook you up with a pediatrician and make sure that your child is tested or has access to someone who can evaluate them if you're concerned about behaviors. We're seeing a decrease in the number of pediatrician visits, obviously. We're seeing a decrease in the numbers of people that are asking for help for birth to 3, and we want to make sure that kids have access to the help and the care that they need. So if you need anything, please call 211 and we will make the referral. Last thing on unemployment checks, I know I've gotten many questions on that. Starting this week, the state of Connecticut should be starting to send out the $600 federal supplement that is due, way overdue, that the system could not handle. That should be starting this week. And many of you have reached out to my office and we've been able to track down where you are in the unemployment, I guess, queue, I'll put it that way. But we are slowly starting to catch up. The Department of Labor is close to having about 85% of the claims up to date now. So if you have any questions, you can reach out to, I'm sure, Representative Rotella or myself. And that is my quick update.
Excellent. Thank you very much, Senator Summers. And with that, we'll go to Representative Rotella.
Hi, I need to unmute here.
You're set. You're unmuted.
Oh, I'm unmuted. Okay.
You're good.
Thank you so much. Thank you, First Selectman Urgo, for coordinating this call. And I would like to reiterate also, Steve, thank you for all the work you have been doing on the front line and to all our healthcare workers. So I'm glad we're here tonight. We're able to provide this virtual update and address some of the concerns and questions that'll come up in fighting this pandemic. I believe, our state's swift and coordinated response during this difficult period of time has been instrumental in keeping our residents as safe as possible. And certainly, as the senator also mentioned, in southeastern Connecticut, I think we've really done a good job at that. And I know residents and families are anxious to know when we will go back to normal and resume our normal activities and reopen the economy. I'm optimistic that the governor, together with the newly formed multi-state council partnership, will find a plan that will get people back to work and back out in the economy safely. Just to speak about the nursing home restrictions, I too, yes, have had a lot of people reaching out to me in regards to that. And, I think it's heartbreaking for people to not be able to see their loved ones that they saw every single day. We are giving out, we have some people who from Verizon who will donate some iPads for people so that they can FaceTime back and forth. So reach out to my office if you need one of those. I'm sure we can both coordinate those efforts. And we're hopeful that we'll find a solution that will allow some visitation in the future, but keep everyone safe, the patients, the caregivers, friends and family, everyone. I also have had a lot of coordinated responses on unemployment checks. People have reached out almost daily on that. And my understanding, I speak with their office just about daily now. They're almost caught up. They're getting caught up. And then on the 30th, self-employed, they'll open up for those particular claims. So again, reach out to either one of us and we can get an answer for you, hopefully, on where you are in the queue. Also, you know, people want to know when restaurants and bars will open, when caterers will open. It's complicated, and I think it's going to take a little longer than we expect to get back to normal. I want to encourage everyone to please continue to support the restaurant establishments that are there and open for pickup and curbside. Our support's especially critical during this time. As we gradually start to open things up, I think it's important for us to remember to maintain social distancing and continue to take all the necessary precautions to keep us safe and healthy. And especially as the warmer weather starts to come, right? So washing your hands often, protecting yourself and others while in public places, wearing masks. It is exciting to hear that the Hartford Healthcare may open up a testing facility near us. That gives me great encouragement for this area. I think also what has come out of this has been a great response by our community in general. In our district, a group of volunteers has started a website called the Share Volunteer website. And it's a site where people can go and they're matched up with other residents needing assistance. And they volunteer and may be able to offer grocery shopping assistance. I think it's wonderful that we're all working together to support each other during this time. I want to speak a little bit about education. Our teachers and our superintendents and our students and our administrators, they are working so hard. And we worked really, really hard in the first few weeks to get everybody what they needed, laptops, get the teachers the education materials they needed, get training on Zoom and Google Docs and Google Classroom and all the things they needed. And those things are going to continue. And so as we move together, I guess we will see what a new normal is. So again, I want to thank everybody. I'm happy to answer questions if you have any, and it's nice that everybody can support one another and come together. And thank you again.
Thank you very much, Representative Rotella, for being here. With that, we will do questions at the end here, and we'll go to First Selectwoman Cheesebro for an update from Stonington. Welcome.
Hi, thank you. No, thank you, Mike, so much for organizing this and setting it up, and to everyone who is joining. So I thought I'd add maybe some updates from kind of the local ground level that are maybe a little bit more positive, since we've been kind of bombarded with just bad news, it feels like every day. So maybe to build on what Kate just shared, the local group Share has been so inspiring to kind of just watch and observe. They've gotten over 30 volunteers in about 2 days time. It was amazing. But I'd say I'd encourage people to sign up, both to get the grocery deliveries, as well as to either get a phone call check-in if you're feeling a little lonely at home, or if you know someone who might benefit from a phone call check-in, you can reach out through the Share website, or you can reach out to us at Town Hall or Human Services, and we can get that going. Another really inspiring group that was just a group of residents that got together is called Stonington Feed Stonington. And what started as a little idea to just support local restaurants, as well as people who might need a little cheer up of a gift certificate to treat themselves to a nice meal out, has now grown. They've raised over $25,000. It's just absolutely amazing. All that money goes back to support local restaurants, and then gift certificates go to local individuals and families. We've actually reached all of the groups that we had thought of, a lot of people who work with Human Services or are part of the kind of free and reduced lunch program and others. So if you know of people in the community who you think would benefit, whether it's a frontline worker or someone else who's been hit hard or recently unemployed that we might not know of, just reach out to us again at Town Hall or Human Services and we'll get them a gift card. It's been just, again, really inspiring to see what the community can do together. Another thing just to plug is really support local. I feel like, you hear it and you see it. We're so fortunate to live in a community where we have local fishing community, local farms, local mom and pop micro businesses, and just we can do everything we can to support them right now. So whether that's going to Seawell and getting some local seafood, going to Pittatuck or Stone Acres farm stand or the Saturday farmers market, or just when you're at the grocery store, seek out things that are local, Stonington, North Stonington, Connecticut, Rhode Island. We can all support each other right now. And also reach out to us if you have ideas. Like we said, Share and Stonington Feed Stonington came from just a group of different local residents who had a good idea. And we're just there to help kind of support those ideas and help take them forward. So if you have ideas, let us know. Maybe on just to also share some things that maybe bring a bit of normalcy to lives. We are working on getting more and more town meetings up and running virtually for the month of May. So we've already been doing Board of Selectmen and Board of Finance meetings, but we'll also be having a first planning and zoning virtual meeting in May, which might be interesting, but we're going to give it a try. We're also having a K through 12 building committee, a Board of Assessment Appeals, probably a wetlands, WPCA, and hopefully also a Mystic River Boathouse Park Committee meeting. So a lot of virtual meetings to look forward to in the month of May in Stonington. And then just to finally add, we are still very busy working on our budget. As I think Stephen opened the call nicely up explaining, it really is every day seems to change. It's a new reality constantly. So the budget that we had first put forward really isn't reflective anymore of the current state of unemployment and the economy and the projections that we're seeing. So Wednesday, the Board of Finance will meet again. We've been working Board of Finance, Board of Ed, school, town, all different departments, police, human services. Just it's been both humbling and inspiring the way the town is really pulled together. These aren't easy cuts. They're not taken lightly, but we are trying to cut everything we can to try and ensure that the mill rate stays flat. And we're going to weather the storm and then see what next year brings. But again, Wednesday, you can tune in at 4 to the Board of Finance's final deliberations, and then we'll be going forward to try and set the mill rate about a week and a half after that. So those are kind of our updates from Stonington. I want to save some time for questions, so happy to take any afterwards. Thanks.
Thanks so much, Danielle. Great update. And I'll give a short update for North Stonington, and then we'll open it up for any questions and comments. And I do see we have some viewers on our YouTube as well as on the Facebook, and then of course we have some callers. So hopefully we'll have some calls, some questions for our guests here. Just from North Stonington's perspective, I'll echo a lot of the same things that Danielle had just mentioned. We're also in the throes of budget, and it has been a challenging budget season, as we knew it would be going into the season as it was, but certainly further complicated by the circumstances that we find ourselves in. Our Board of Finance also meets on Wednesday, and I believe is toward the tail end of deliberations. So we're looking forward to that. I'll just mention, we did opt to give some tax relief to people. I think Stonington actually is doing the same as North Stonington is, where you just fill out a form if you're impacted negatively by this COVID-19 from an income standpoint. You can fill this form out, get it to the tax collector, and then you would potentially be able to not have to pay your taxes until October, whereas they're normally due the end of July. I just want to mention revaluation. We happen to be in revaluation this year in North Stonington, and obviously that's a strange thing where we're not going to be able to have the revaluation company go into people's houses. So they have mailed letters to everybody. So we really encourage everyone to fill those out and get them back to the town assessor. That's really important for the asset of your home, to make sure it's correctly depicted with the town. Certainly comes into play if you ever were to try to sell or anything like that, but important for a variety of reasons. So please return those forms. I want to mention the census. We've had a lot of talk about the census lately. It's of all times to be in a census, maybe it's a good time because people are home, and I would think have time to fill out the census information. So we really need everybody to complete their census information. The towns, the cities, the towns, the counties, the state, we depend on accurate census information for the funding that comes our way. So please, if you have not filled out your census forms, please go on Census 2020, 2020census.gov, I think it is. Or you've gotten something in the mail, I'm sure, and please fill it out, send it back. It is tracked online, and North Stonington and Stonington are both doing very well. But we have, I think, about half our town still to go. So we want to see that, happen. Just from some good stuff happening in town. I think, you may have seen the farmers co-op that's happening here. We're pretty happy that the Chinook Brewery and Village Cafe down here in North Stonington Village is doing a village co-op of different farmers are able to sell their merchandise there. And we encourage people that are in need of food, which is everybody, to consider checking them out and support the local farms. It's a great way to support locally and be able to kind of safely get the food that you need in a really comfortable way. Just want to mention the the governor's orders, the stay safe, stay home initiative, which is still happening. And I think we're all seeing the news, and, I know people are getting antsy about things, but just really crucial to kind of just continue. I think everybody here has said that already. It's we want everybody to come out of this as healthy as possible, and as much as you're able to, really kind of, you got to wear the masks when you go out now in public places where there's going to be people. So make sure you do that. But as much as you can, stay home and try to just, let's weather this and get through it together, and let's finish it strong, so that when we do come on the other end of it, it's safer for everyone. So with that, I'm going to yield my time to the public if there's questions and comments. So if you're on the phone and you've called in order to unmute yourself, you would hit *6. So you can feel free to go ahead and do that. If you have a question now, I'll open it up to the phone people first. If anyone has a question.
Yeah, I have a question.
Yes, welcome. Who are you?
Hi, my name's Sharon Lynch, and I live in Stonington. And I have a question, I think probably for the gentleman who spoke first from Ledgelight. I'm sorry, I don't have your name.
It's Steve Mansfield. He's Director of Health.
Hi.
Yep.
Hi. Today in the New York Times, there was an article that listed the places in the United States that were hot spots with the highest average daily growth rate for deaths. And Norwich and New London, Connecticut was listed second in the United States as the highest daily growth rate for deaths. And so that was an alarming thing to wake up to this morning. And I know that other models at Georgetown have published similar projections. So I wondered if you could talk about that, because it's not in line with what's being published every day at the state, but here's a projection.
Yeah, I haven't read the article, so I can't comment specifically on that, but I can tell you that the numbers that are reported to the local health department and to the state health department are low in southeastern Connecticut compared to most of the rest of Connecticut, except for, I believe, Tolland County. So I really can't comment on why New London would be up there. I mean, New London isn't even number one in my jurisdiction, so I can't imagine how it would be on any national list. But I'll take a look at it and see if I can make heads or tails out of it. But it doesn't make any logical sense to me.
Okay, if I could ask a quick follow-up question. Do you
Sure.
have any means of finding out the prevalence of COVID-19 in the general population by taking anything like a random sample or projecting from the numbers that you do have? Because we know you're testing people who are ill or who are dying, but from just a general population, the prevalence of the disease.
No, in Connecticut, there just simply haven't been enough tests done to make an accurate prediction of what the disease burden is in the population. Connecticut DPH has some really good numbers and projections. They rely on John Hopkins a lot for some of the data that they project, but I haven't seen anything out of the Department of Public Health that provides, an accurate picture of what the true disease burden is in our communities, other than to say it's significantly higher than what we know to be true.
Thank you.
Thanks, Steve. I see another question. Is it Rachel there?
Yes, hi. My name is Rachel Siri Bundesman. I'm first of all, thank you all for the work that you do and for being here tonight. A quick question, not a big issue now, but moving forward. I live in Mystic, actually on the Groton side, but I saw this in the paper and I decided to call in. I'm a walker, and some days there's a lot of foot traffic in downtown Mystic. Is it possible, would it be possible in the future, the pedestrian walkway over the bridge? Is it possible, would it be possible to make those one way?
Yeah, I can answer that. Actually, we've been talking with John Burt, the town manager in Groton, actually last week, and we got our police commission to also approve it as well. So there will be on one side of the walkway will be one direction and the other side will be the other direction. So those signs should be going up really soon.
Perfect. Thank you so much.
No, thank you, Rachel.
Yes, I see phone number 3754. Question.
Sean Murphy, how are you?
Sean, thanks for joining us.
Well, happy to be here. Thanks for putting on this conversation. I had a comment, or maybe like the senator and our state rep to address this. It has to do with passing of the town budget. The governor, as you know, the governor has the executive order that's changed that for the towns, or how that will happen, and it does not allow for a referendum vote. And I just think that that is very restrictive, that it's possible to conduct a referendum in such a way that it's safer than going to the grocery store or going to the liquor store. The other tasks that are allowed to go on. And I think we're taking away people's right to vote, and I think it should be reconsidered. Also, it's restrictive to the fact, the point in North Stonington, whereas as soon as the the hearing takes place, after hearing feedback from the public, it allows the Board of Finance themselves to approve the town budget. And it leaves the people that, and not everyone in town, not many people in town participate in these Zoom virtual meetings. So the input isn't really getting to the Board of Finance as it would with a referendum. And I also think that, if this should be lifted, if nothing else, if we weren't allowed to conduct our own referendum, allow us to delay it and have a budget referendum at the same time as the primary. It could be quite possible that the front of the ballot could be the primary vote and the back of the ballot could be a referendum for the town budget. What's your thoughts on this?
Thanks for your comment, Sean. I don't know if either the senator or representative want to weigh in. If not, I have some comments, but.
So, I would say that the governor allows the town to have flexibility and the town has to set their rules. I would encourage him to speak with his local leaders to see what they're doing and how they're thinking about going about it. And Mike, if you have some comments, that would be great.
I'll go to the senator first. I think she had a comment.
Yeah, sure. I was muted there for a minute. I would just like to say we have to keep in perspective that this is an unprecedented situation. This is something that we have not experienced in over 100 years. I personally want to have as much input from the citizens as we can, although this is a very, very difficult situation. There was a push to have towns be able to adopt budgets later in the year. And then the towns would work off the previous budget until that budget was approved. I think that there are ways to have a town educate people on Zoom, or they can talk to them on Facebook, or they can call when they learn about what's going on in the budget. So I do think that there's an opportunity to have public input even in these unprecedented times. That being said, right now, the state is being run by Governor Lamont and the administration. He has full executive power to do whatever he decides and his administration decide until September under the public emergency powers. So as much as we have advocated to allow municipalities to choose, do they want to delay? This has been the decision of the governor, and they are not moving off of that at this point. So I think in perspective of that's where we are, that's what's coming down from the administration, whether we like it or we don't like it, we need to do everything to reach out to the community members to make sure they understand what's going on and to try to provide as much input as we can under the circumstances that we have. And that's what I can share.
Thank you, Senator. I would just add that, I guess I've kind of tried to find a silver lining in this situation with regards to meetings. I'm feeling like our meetings are more heavily attended than they have ever been, because people are feeling that it's easier to attend a meeting. And in the Zoom, if you're not technologically savvy and you don't want to get on a computer to do the Zoom platform is you just call a phone number and put in a code. So I think it's pretty easy, but maybe we should look to do some more trainings with that. I think the hearing, I'm looking forward to probably a better turnout at our public hearing than I think we've had in years, is what I'm hoping for and we're pushing for. But with all that being said, I agree with you 100%, Sean. Our hope would be to have a town meeting and then referendum. We can't go in opposition to the governor's orders. I don't think any elected officials want to have the burden in our, obviously we're non-chartered, so it's a little bit different for us. We have to operate under state statute. I know our Board of Finance members, our Board of Selectmen, we want it to go to the voters, but we also were elected to do a job. And if that's what we have to do, that's what we'll have to do. And I think the people should have confidence that a lot of hard work has been going into this, and it's been a lot of deliberation, and it continues, and it'll continue Tuesday night, it'll continue Wednesday night. And I hope the voters can have some confidence that a lot of hard work's going into this, and these decisions will not be made lightly, but we do hold out hope that we will be able to go to a referendum vote. So more to come on that. Do we have, I have a question coming in from YouTube. I'll read that. Let's see, many calls coming in. If Senator Summers or Representative Rotella could speak to the small business owners I think in Stonington and probably in North Stonington as well. We've received many calls from local small business owners who are really struggling and have not received unemployment or have not heard back regarding small business loans and grants. Is there any update that?
Sure. Who is that from? Who's that?
That's from Stonington.
Just from Stonington?
Well, Stacy.
Is there a person? Okay. Well, the people that have contacted me or reached out to me, whether they're small businesses or they're individuals concerning unemployment, our office has given them an update as exactly where they are in the queue. As many of you are aware, the Department of Labor was working with, or is working with, antiquated equipment from the 1970s. In my opinion, they have not done a good job at getting out the unemployment checks. Again, this is under the governor's jurisdiction, but they now are at about 85% of the unemployment checks are out. And if they were late, they are supposed to be caught up. So they'll be retroactive this week. The $600 bump up from the federal government is going out as of April 30th. If you are self-employed, you can now apply for unemployment. As far as the SBA, they were overwhelmed with requests from the business community. I believe they got close to 30,000 requests within 2 days, and they have not ended the program. They put it on hold, and they're trying to weed through and process them. I know it's frustrating. If they want to reach out to myself or Kate Rotella, we can try to find out where you are in the queue. But again, both Representative Rotella and myself are just the facilitators of the information. We can't expedite it for you. We can only find out where you are in the queue. And because we're not running that program, that's under the DECD. And again, we're hoping with the next tranche of money that may come in from the federal government, one of the things that I've been advocating for is to make sure that that money goes to our small local businesses, which is what it was intended for to begin with, and to make sure that we can sort of speed up the process. But that's the reality of where we are. And if anybody has a particular issue, I know I've talked to dozens and dozens of business owners that I've been able to help direct to one place or another, whether you're a farmer or a small business owner, of a retail shop or a restaurant. They've called me and we're being able to try to navigate this landscape of what's going on. I'm happy to do that. I'm sure Representative Rotella is doing the same.
Thank you, Senator. Yes, Kate.
Yeah, so I mean, I would say all the same things, and yes, I get the same phone calls every day also. And I would encourage people to continue, the small businesses especially, to continue to apply for the PPP program. The federal money more was available today. And as I said earlier, and I think the senator also said, April 30th, you can also, self-employed people can apply for unemployment. Just apply. And if you need help finding out where you are, we can try to give you that assistance. But I agree, we are the facilitators. This is not anything that we have any control over, but we are, both our offices are happy to try to get you help with that. And another thing I think that is really important is that as we come out of this, we remember how important it is to support our local businesses. So I hope that comes out of this too, is that we start to remember that.
Thank you, Kate. We've got about somewhere around 5 to 6 minutes left in what we had scheduled here. I'm wondering if there's any other questions from the phone. If you do have a question and you're on the line, you just have to hit *6 to unmute yourself. So do we have any other questions from any callers calling in?
Yes, this is Sean Murphy again. I just have a comment for the first selectman from Stonington. I just wanted to congratulate Stonington on their ability to understand the economic impact on your town and to go back and be able to readdress the budgets. Unfortunately, in North Stonington, we haven't been able to understand the impacts and still have a general government budget and a Board of Ed budget that are projected to be significant increases. So I just wanted to congratulate the Stonington for understanding that.
They do a good job over there in Stonington, Sean. They've got a lot of houses on the market over there too, I think. But that's just a joke for you, Sean. It's been good fun. We're going to do our best, Sean, and we appreciate the comments. And believe me, the Board of Selectmen's meeting tomorrow night, Board of Finance's meeting on Wednesday. So we are not done. We are continuing to work, and we do understand the economic impact in North Stonington. So, but I do commend.
Thanks, Mike.
You're welcome.
There's no rush on a budget.
Okay, thank you very much. Any other comments? I see another unmuted resident maybe over here. Is that Brian? Did you have a question?
Yes, I do. About the economic impact this whole thing's having on us. I didn't know if there was any talk or consideration up at the state as far as maybe lowering or giving relief somehow with the state sales tax or the state income tax. I guess that would be directed to Representative Rotella and Heather Summers.
Any comments on that from our state reps? Did you hear it?
Yes, I have not heard of any consideration as far as reduction in either, I think he said sales tax or income tax. That is not something that I have heard that is under active consideration. We are trying to wrap our, our minds around how this impact is going to translate. We know that there will be a significant loss of revenue. We've looked at the rainy day fund that we have being in a deficit of about 500 million this year and maybe 1.4 billion the following year. It's significant. We don't honestly know what the ultimate impact will be, as we can't say right now what life will be like. I don't believe that things are going to go back to the normal that we knew before. I think it will be, a different way of how we live our lives if we can't find a vaccine for this particular virus, etc. So we're wrestling with that now. I can tell you one of the things that I have been pushing for in the last session that I'm hoping will be something we will consider during our special session is an economic development project, which could bring tremendous job opportunities here in Eastern Connecticut and help the local municipalities directly. So that's something that I've been actively working with the governor's office, because we need to think of how we can restart our economy. And this particular industry does not require people to be in close contact, etc. But we are just beginning. Right now, we're going from one pandemic of the virus to our economic pandemic of what we're going to look like as a state, as are many other states. So that is not something that's under active consideration that I have heard. Maybe Representative Rotella has heard something different, but we can keep you updated. And I can tell you, we are all looking for ways to try to provide as much relief as we can for our citizens, because we know and understand and empathize, and we're all living it too, how difficult this is. Again, it's unprecedented. We are going through uncharted territories and waters that we have not been in before. But I can tell you that the citizens and the well-being of our municipalities and the livelihood of those who live here in our state are always on our minds. And will continue to do, or I will continue to do whatever I can to make sure that whatever relief we can provide, we are able to do that.
Kate?
So, yeah, I think it was Brian. So I have not heard of any lowering of the sales tax or the income tax at this particular point in time. I think it's positive that we did not raid our rainy day fund, and that, we do have some money in there to hopefully get us moving in the right direction in our economy. And I will also do everything I can to keep the economy growing and support our citizens. So thank you. And I know on the appropriations committee, we're working very hard on different solutions and how we will work through this with our new budgets. So thank you.
Thank you, Kate. And that brings us to 8 o'clock, which is our hard stop time tonight. So unless any of our panelists have anything else to add, I'd like to just thank everyone for taking the time out of their busy schedules, especially Steve Mansfield, who I know is just constantly, just amazingly doing the work with your team over there, and our state reps, our Representative Rotella, Senator Summers. Just thankful to have you guys out there working for us, and it's an honor to be joined by Danielle from Stonington. Going to take some tips on what Stonington's doing over there, and they are always doing good work. So other than that, we want to thank everybody for joining us tonight, and we want to wish everybody stay healthy, stay home, stay safe, and have a great night.
Thank you, everybody.
Thanks, everyone. Thanks
Bye.
for hosting, Mike. Appreciate it.
Bye. My
Thanks,
pleasure.
Steve, again for all
Bye.
you do.